The Gut Feeling Initiative is our program with the overall goal to reduce the amount of negative health outcomes Nova Scotians have to face as a result of chronic gastrointestinal disease-related morbidities. Chronic GI diseases affect a large number of Canadians, with 13% of the population experiencing GERD, 10% experiencing chronic constipation, 0.7% with IBD, and around 6.2% with IBS. Obesity is a major risk factor pertaining to GI disease development because it encompasses a melting pot of risk factors including poor lifestyle habits, low physical activity, overprocessed diets, and high stress, elements that are key to inflammation buildup in the gut. As such, our objectives over our 2-year program will be to reduce the incidence of obesity by 20% among youth in Nova Scotia and to reduce the amount of hospital admissions and doctor visits in Nova Scotia related to GI symptoms by 40%. Nova Scotians are particularly at risk as they have the highest obesity rate in Canada at 25% and highest incidence rate of IBD in Canada at 54.6 individuals per 100,000 people. We will be implementing a variety of activities to achieve our goal, and those will include visiting 50 public schools that host workshops with youth and parents that educate them on living a healthy lifestyle, as well as funding community gardens that will produce healthy foods that can help low-income individuals as well as those that are affected by trigger foods. Our programs will be supplemented with a mobile application that provides info on healthy foods and lifestyles, as well as garden locations. We will also lobby to partner with the Nova Scotia provincial government to update their Let's Get Moving Nova Scotia action plan to implement legislation making physical education mandatory in primary school, which is not required anymore, and to increase the current inadequate requirement that exists for high schools. We will evaluate our efforts by surveying our participants within the first 4 weeks of the program, continuing at 3-month intervals. To be able to track development and the program's impact on individuals and groups, we will use surveys to improve the quality of interventions and experimental designs, and this design will randomly select individuals to compare the effect of the intervention between a group of students that attended the workshop and a group that did not. Additionally, long-term outcomes will be evaluated through surveillance data from CPC SSN and SCI to determine obesity incidence rates and doctor and hospital information. We are requesting $110,000 from private investors, $15,000 per project year from the Research Nova Scotian Development Innovative Grant, and $10,000 from the Nova Scotia Health Authority Wellness Fund, totaling $150,000. We plan to begin the program on January 5th, 2020, and will run it through September 30th, 2020.